So can you offer an overview then how logosynthesis can be integrated into a treatment plan to address ADHD?
And in logosynthesis, what is there, I use it for over 15 years, and not only for ADHD. What I discovered is that logosynthesis reduces stress symptoms and is dealing to clear your or how your brain is dealing with information. So the stress reduction is very good with using logosynthesis. And also you can deal with different injuries to let them go or to change them. So the stress reduction and also the emotional reactions are going down. And then if the emotional reactions are going down, your cognitive or your cognitive brain is working better. So it's about stress relieving.
Yeah, because you're not really stuck in that kind of react, distract mode as much, are you? If you can kind of identify what triggers you to get into that distract mode.
I used until now only the one-to-one situation with one client in my practice, psychotherapy practice, and then I do it also what is stressing you, what is like the procrastination or not the hyper activity or the activation about some serious situation at work or about learning or about some relationship issues. So it's just a normal psychotherapy, and it's all about the stress reduction. So what does causes stress, and I just go for those issues like in other psychotherapy. And some weeks ago, I started with a colleague, with Marcus Hemmerly, I started a new program. It's a HDHD group program where we now treat 4 clients. It's the first course where we have two issues. One is to get educational part where we give the information how could they use logosynthesis as a self-coaching, to how that they get known to logosynthesis, to use it for themselves.
Yeah.
And in the second part, I take over the psychotherapy program, the 1.5 hour also for psychotherapy in the group. So I work with one, and the others could watch it, and some could integrate also what they see there, because they have very similar issues. So let's see what is going on.
Yes, we sometimes call that on the bus, don't we?
Yes.
That when somebody presents something that bothers them, it can tend to be a little bit more widespread, doesn't it?
Mhm.
Yeah.
And the client like it very much. So we next week we will no in 2 weeks time we will finish the first course, and then we will have we'll see what is the outcome, and we will start with the second course this year already, and we will continue next year to have those courses in Bad Ragaz then.
I find that interesting because definitely in a group, people start to realize that, issues that we tend to keep inside and we don't like to talk to them, and we think or we know that we have a medical diagnosis around it. So sometimes there might be some shame around it or some discomfort around talking about it. But when they're in a safe group with 4 clients, it sounds as if that's something that you can quite quickly start to see how similar a lot of these situations are. And I say that just from my training with logosynthesis, a lot of it is in groups, and so many of the issues per se are similar issues, aren't they?
they are very similar, and so they see what could happen if I use logosynthesis, and they could watch, and so also see how they could use it for themselves. So what are the triggers? It's not so easy to find the triggers, and what are the reactions? And so they learn also in this psychotherapy group or part. So they see how I apply the logosynthesis, and I think it's much more efficient if you have a group, not only one-to-one, because we have only one client and then the other. So if you have a group, I can take up to 10. Then you are more efficient. There are more people see it at the same time or learn it at the same time.
And there's so
And
many aha moments in that learning because there's things that we thought were part of our personality or things that, some of the labels that we carry with us. And then it's like, that's just frozen energy. I don't have to stay stuck in that reactive pattern or that stress pattern.
Yes.
I can shift it. Yeah.
And we have this program only for 6 afternoons planned, and then it stops, and then they go on their own.
Wow.
They are the most of them are also in a psychotherapy of their own. So it is a combination about the psychotherapy or the medication they are taking and this group program.
And again, that speaks to the integrative nature of it, right? Like you're not saying do this instead of doing medication or individual psychotherapy, but it's something that can complement the work quite well. Yeah. And so this work that you're doing, this group is meeting in person, but I understand you've also written a paper on virtual psychotherapy or virtual group counseling with logosynthesis?
Yes, it's for the first. We wanted to go local because of the focusing or the concentration. We didn't know how is this attention level with the person. So we thought it's easier to have them on local to see how they are attentive and get through the process. And we see it works very well. And if we have to use the second or the next courses to see if it's very easy to get them focused for 1.5 hours for each part, then we could use also the online thing. But then I think we could make a different outline that we have shorter times for working times. But that we first wanted to have them on site to have them more connection, because on the screen you don't have so easy to connect and to hold.
Yeah, and if you're prone to distraction, there's a lot of distraction you can find on the screen. However, I do a fair amount of online work in groups with teaching the Logosynthesis 101 self-coaching course, and I find, it is so enriching. People get so engaged in the work that the time flies by, but it's a lot of awareness raising and shifting and energy shifting. So it's it does work well with the virtual, but I can see the point if you're dealing with people with a diagnosis of ADHD to have that in-person live is pretty powerful.
Yes, and so we have to see how it works, and then if we make the review, and also after the first one you can't really do a review, but we have to have some more courses done, and maybe we could make them or train other coaches or counselors to do this program also in Germany. For example, we are already in connection with some logosynthesis practitioner and counselors, and so we could distribute this program also in other languages, of course. We could do it also in English, and then I think it should be then online, because the English group is very